Thank you for the generous introduction. It's a wonderful opportunity to collaborate with the International Hale Building Council. And in your mid-year conference, I believe that the Philippine College of Lifestyle Medicine and your council is in agreement when it comes to recognizing the crucial role of the built environment in promoting a healthy lifestyle. Before I move on to the discussion, I just want to share a bit of a background and why I feel that this topic assigned to me was special. Um, I'm an organic agriculture advocate and accredited training provider, and this is under the Agricultural Training Institute. I'm also an advocate for the Foundation of the Philippine Environment, and I'm founder of Community Teaching Kitchen and the Asian Institute of Culinary Medicine that mostly promotes plant-predominant diet food preparation. And I'm a member of the Earth Savers Society. So we go to places to explore fauna and natural habitats and conduct programs and activities that will prevent the degradation of preserved species. And I am personally passionate about preservation and propagation of ethnobotanical species and habitat. So I'd like to thank Dr. John for this opportunity to share this part of my personal, which turned out to be a professional advocacy. So in the next 30 minutes, we want to review the evidence supporting dietary patterns for personal and planetary health. And then we'll understand international and national recommendations and guidelines on diet, nutrition, and health. And then we'll identify evidence-based dietary solutions to climate and interrelated crises. I'm sure that you are already aware that more than 11,000 scientists' signatories from around the world unanimously declared that our planet is facing a climate emergency. Carbon levels are rising, the glaciers are melting, the ocean is getting hotter, sea levels are rising, and so the extreme weather events and fossil fuel use is going up. So why are we talking about this? Well, I'm tasked to discuss about what all of us should know about our food system that is a direct driver of a number of our interrelated health and planetary crises. We're losing more plant and animal species. There's inevitable global warming. We are facing a health crisis, and more people are spending their last decade of life in sickness. I highly appreciate that in this event, you wanted to emphasize why it is so important to be recognizing the food system in relation to the planetary health. Well, it is widely established that animal agriculture is the leading driver of climate crisis. It is leading cause of water pollution and also habitat destruction. I know we've heard about the Amazon being destroyed. It's being cleared to grow grains to feed animals and soybeans to produce highly processed oils, but we seldom hear the discussion. About 91% of that destruction is because we, humans, are demanding more and more animals for food year after year. So that about 70% of farmland in some developed countries is dedicated to raising animals for people to eat. Now, since livestock production is the single largest driver of habitat loss, somehow reducing meat consumption is also the key to biodiversity conservation. And if we go back to literatures, this can be achieved by ideally reducing demands for animal foods by increasing proportion of eating plant-based sources to about 90% of the diet. Now, in this slide, you can see the graph in the right-hand side showing the carbon emissions from the food that we eat. And at the top, you will see the list of all the animal products that people consume. And at the bottom, you will see that the lowest environmental impact is every single plant food you can think of, regardless of how these are produced, how they are transported. And we will see that every choice people can make to increase consumption of plant-based product has significantly less carbon footprint than any single animal food. Now, if you look at the IPCC report, now this working group published that we have less than a decade to change the planet crisis trajectory. And I thought this is even mind-blowing because they put the food system as the center of the plans to change this trajectory. Now, this is simply telling us that the single most impactful action we can take as individuals in helping planetary health is to change the way we eat food. Now, in this report, it states that reduction of excess meat consumption is amongst the most effective measures to mitigate global health gas emissions, with a high potential for environmental health, food security, biodiversity, and animal welfare co-benefits. Now, here, the Paris Agreement frames a political and scientific consensus to keep the increase of global mean temperature by 2100. Their goal is to achieve less than 2 degrees Celsius. But this paper also states that even if fossil fuel emissions were eliminated immediately, emissions from the global food system alone would make it impossible to limit warming to 1.5 degrees Celsius and difficult even to realize the 2 degrees target. Now, staying within the boundary for climate change can be achieved by consuming plant-predominant diet. But as health professionals, we are also looking after people with chronic disease, and we know that most of it are preventable. Now, looking at the Global Nutrition Report of 2021, it was stated that our global food system is responsible for 1 in 4 deaths that occur globally. And in addition, as we've heard, the food system is creating 35% of all greenhouse gas emission, and more than 50% of that comes from raising and consuming animal foods. Now, back in 2019, there was an in-depth analysis from the Global Burden of Disease Study Group looking at dietary risk factors from 195 regions around the world. And that time, only 1 in 4 premature deaths occur because of unhealthy diet, right? But in-depth details showed us that the key dietary risk factors were diet high in sodium, which is, of course, the reflection of our reliance on processed and packaged food. But take a look at the second, third, fourth, and fifth to that. This is because we're not consuming enough healthy plant foods. That's whole grains, fruits, vegetables, nuts, seeds, and legumes. And this is leading to death and chronic illness from cardiovascular disease, type 2 diabetes, and cancer. And going back to the Global Nutrition Report, it was sadly shown that no region meets their recommendations for healthy diets. So now the clear question would be, what is the healthy diet for humans and for the planet? Well, this question was scientifically and politically answered in 2019 when the Eat Lancet Commission published the Planetary Health Plate. Now, this is a result of more than 2 years of collaboration between 37 experts from 16 countries around the world. Now, they devised a diet that not only was healthy for us, but would keep the food system within planetary health inclusions. So here you can see that half of the plate is dedicated to fruits and vegetables, about a quarter whole grains. The green here is plant-derived protein. Now there's unsaturated fats from plant sources, limited sugar. And then you can see that a small portion is giving you an option if you really want to continue eating animal foods. But it clearly said that it should be less than 13.5% of your energy or calorie on a daily basis. Now, it suggests a range of total meat consumption of no more than 28 grams per day, or like an ounce a day. So it's like a weight of a single tiny chicken nugget that you buy from McDonald's. Now, at the same time, the overall increase in consumption of legumes, nuts, seeds, and vegetables to more than 100% is actually needed. Now, this is how the recommended diet should have. This amounts on the right side would show you how much animal food is recommended in a week. So in a week summary, for red meat, it's less than 100 grams, 2 portions of poultry, and around 3 eggs per week. And to put this into a graphical presentation using data from the most extensive analysis farm to fork analysis of the environmental impact of food published in 2018. Now, you can see the foods that not only promote our personal health, but have the lowest environmental impact are the fruits, vegetables, whole grains, beans, nuts, and seeds. Now, again, what makes designing a sustainable plant-predominant diet easy is that the same advice, like eat less meat, is good for both personal health and planetary health. The least healthy foods also cause the worst environmental impact. And the food that makes the most nutrition just so happen to be the foods with the lowest greenhouse emissions. So we get this win-win effect. Now, this paper published recently analyzes the co-benefits of personal health and planetary health in a prospective cohort study. The EPIC study has nearly 500,000 participants from 10 European countries, followed for about 14 years, and they assess the impact of each Lancet planetary health plate and what that would mean for personal health. Now, this paper showed that if we were adhering to those guidelines, we could reduce the risk of premature death by 63%, and we could prevent up to 40% of all cancers. And thankfully, we can reduce greenhouse gas emission from the food system and by 50%, I mean, and free up 62% from all of the global farmland. So what if we decide today to adopt a plant-predominant diet? I know you will ask, is it safe? Is it healthy? Is it nutritious? Well, the answer is absolutely yes. We have all the data from associations around the globe telling us that plant-predominant diet can support healthy living for people of all ages, and that's from cradle to grave. Now, you might be asking me, how do we know that? Now, we've got populations around the world termed the blue zones, which were defined by the demographer Dan Buettner and presented his research in the National Geographic magazine. He describes regions around the world where people live the longest and healthiest lives. It's Sardinia, Italy, Ikaria, Greece, Okinawa, Japan, Costa Rica, Loma Linda, California. So of course, there's more than one aspect of their lifestyles that they share. But the bottom line here is that the built environment for these blue zone areas is conducive and designed for them to have a healthy choice architecture. So this is where the healthy choice becomes the easy choice. Their environment, culture, and the way they live their lives resulted to longevity. So again, it's the choice architecture that increases their lifespan. Of course, if we compare their built environment to what we have now in the Philippines, you may say that, you know, change could be close to being impossible. But in the Philippine College of Lifestyle Medicine, and of course, I know in your council, I believe that we are promoting that rising small communities and individual household can be built as a little blue zone. Now, there is this 9 lifestyle factors that they all share in common, but today our focus is on their dietary intake. Now, when you look at the data, you can see that 95 to 100% of their daily calorie comes from plant-based sources. They eat mostly whole foods, minimally include processed plant foods, and they have a daily dose of beans. So beans, as the main source of plant protein, is key to these areas in the world where people live long, healthy lives. So as we can see, the healthy planetary diet would fit the blue zone eating pattern. Now, we have prospective cohort studies. You know, these are data from the Nurses Health Study and the Health Professionals Study, follow-up study from Harvard University that followed more than 170,000 men and women for about 3 decades now. They've looked at the impact of healthy diet and alongside other healthy lifestyle factors. So they identified 5 lifestyle factors, and these are about people who've never smoked, with healthy weight, healthy diet, and regular physical activity. When you look closer in the dietary risk factors, they score the diet high if you consume lots of fruits, vegetables, whole grains, and saturated fats, and plant foods, and omega-3 fatty acids, which obviously comes from plants or fish. And a healthy diet is low in red meat, processed meat, sugary beverages, trans fat, and salt, and processed foods in general. So what do you think happened after 30 years of having a healthy diet and lifestyle? Now, this study showed that if we adopt healthy plant predominant diet, we can reduce a risk of dying from cancer by 30% and cardiovascular death reduction by 33%. And if we have all 5 healthy lifestyle factors, cancer deaths are reduced by 65% and cardiovascular disease by 82%. Now, there is absolutely no pill or procedure or medication we could prescribe that will have these health outcomes. In fact, study shows that even if people are compliant with their maintenance medications for hypertension or high cholesterol, it will only typically reduce cardiovascular risk by 20 to 30%, and their condition can still progress over time. But the Interheart study in 52 countries showed that for men and women, old and young, in all areas of the world, modifiable lifestyle factors, including healthy dietary intake, can prevent over 90% of cardiovascular risk factors. And equally important is the co-benefit that we can get to reduce the footprint of healthcare industry. We can reduce our reliance on the healthcare system. We need to promote preventive healthcare to self-reliance, and self-reliance, of health. If we look at the Chuchi study, now this is the Asian version of the Caucasian studies that we reviewed earlier. It showed us that vegetarian participants use 15% less medical expenditure, and that was from going less to outpatient department, less medications compared to their omnivorous counterpart. Now, this simply means that in economic analysis, it was found that the economic value for the personal benefits associated with more plant-based diets is comparable with or even exceeds the value of the environmental benefits. Now, I fully appreciate that diet and lifestyle choices are very much tied with socioeconomic determinants of health. That's why we need to address both. We need to address access and affordability of our health food so that our people can access this. So what's the international consensus when it comes to health? Can we be promoting this type of eating patterns to our patients to live a healthier and quality longer life? That may be your question. Well, for healthcare providers who are joining us here, we should already know that the answer is absolutely yes. This is embedded in international guidelines. The American College of Cardiology has published guidelines in 2019 for the primary prevention of cardiovascular disease. They recommended 2 dietary patterns, and that's plant-based Mediterranean diet. Now, when it comes to the consensus on treatment of type 2 diabetes, lifestyle modification underlies all therapy. All patients should try to maintain an optimal weight through lifestyle intervention and primarily plant-based meal plan. So for both pre-diabetes, diabetes, and for high cholesterol and prevention of heart disease, they all recommend the same dietary intervention. Now, what about cancer guidelines? Well, yes, absolutely. The recommendation is to eat diet rich in whole grains, vegetables, fruits, and beans. And it also says limit consumption of red and processed meat. But in the real world of medical practice, these guidelines are yet to be relearned by healthcare providers. Most of us are confused and indecisive on which to follow and recommend. And this is primarily influenced by the culture, familial, and personal practices that we have, because we can least likely recommend a plant-predominant plant or plant-based diet to our patient when we do not personally practice it. And what about the dietary guidelines that we can find in national level? I would say that it's somehow catching up. So if you look closely, this is the Canadian Food Guide, and it's very similar to Eat Lancet Planetary Health Plate, right? So half fruits and vegetables, quarter whole grain, quarter protein, and of course the intake of water. Now, how about our Pinggang Pinoy? It did not represent plant-based as major source of protein though. And to me, it's giving a message to choose fish as the primary plant source. Now, we've discussed that when it comes to protein, for the co-benefits of health and planetary, choose plant sources, beans, nuts, seeds, and legumes. We know that a combination of a variety of plant foods can absolutely supply the dietary source of essential amino acids that we need. Now, this is a typical Filipino plate, and only few of our population are eating 5 servings of fruits and vegetables a day. And our reliance to processed and delivered foods are getting far too much as well, right? So, and sadly, almost all of our hospitals traditionally serve more meat than fruits, vegetables, and whole grain may not be included at all. Now, after going through the evidences, consensus statements, clinical practice guidelines, and global recommendations, we can't argue more. This is the right direction we should go. We need to promote plant-predominant food consumption to achieve the co-benefit of personal health and planetary health. It's time for healthcare professionals to normally recommend and prescribe a plant food or plant-based food system. Our choices matter. Without addressing food production, we cannot meet our climate targets. Healthcare professionals should be leading by example and supporting patients to make healthier choices that will improve their quality of life and those of the future generation. We're not just in a climate crisis, we're also in health crisis. Where unhealthy diet causes more deaths and disease than alcohol, drug, tobacco, and the combined usage of this. And as presented, we can address both crises at the same time by increasing our consumption of whole plant-based foods and sustainably decreasing our consumption of foods from animal sources. Now, eating this kind of diet could save the lives of more than 10 million people each year and may just help save the planet. But this movement is like a double-edged sword because this would also lead to the loss of millions of jobs linked to animal husbandry and production of unhealthy foods. Now, sustainable sensitive agriculture is also one of the effective directions that both the government and private sectors are taking. The beneficiaries for this project include different types of people's organizations like women, Rural Health Improvement Club, and the Farmers Association. And women here were given emphasis in this program, recognizing the central role of women in agriculture and nutrition. Sustainable diets should be cheaper, and we have to emphasize this. It should be cheaper and healthier. And local farm produce is, we know, cheaper than the produce we buy from the grocery stores or in the malls. Now, our goal is to transition our plates one meal at a time. I hope I have persuaded you that there's a lot of evidence to support plant-predominant diets for personal and planetary health. And let's start this enculturation in the young and receptive minds of our children. So in conclusion, evidence show support to plant-predominant diets for both personal and planetary health. National and international guidelines are catching up with the evidence and guidelines. Human health and dietary patterns must be considered in the context of global planetary health. Thank you for spending your time for this discussion. I hope we have learned through this 30 minutes of sharing in terms of improving both health and the planetary health. Thank you so much.